Hello, my name is Heather O'Callahan. My student ID is 3062514, and today I'll be performing the Nursing Foundation's Personal Protective Equipment Lab, which demonstrates how to properly don and doff your equipment. The reason why we use PPE is to create a barrier between the nurse and the patient to stop transmissions of infection or disease. There are 3 different types of precautions we use, and that is droplet, airborne, and contact. And depending on which one, we use our PPE differently. I will first start my donning process with hand hygiene. This is an alcohol-based waterless hand sanitizer, and I'm going to make sure that this hits all surfaces of my hands, including the cuticles and under the nails until it's completely dry. Following that step, I am going to move on to applying my gown. I'm going to secure my gown by tying the ties, the top and at the middle. Following that step, I'm going to move on to applying my mask. And following that, I will use my protective eyewear. Like I said previously about the different types of precautions we use, we also have a face shield that we can use and an N95 to further protect us and stop the transmission of disease and infection. Following that step, I'm going to be moving on to my gloves. Ensuring that that covers my gown as well. So there are no openings. Perfect. So this is how to properly don your equipment, and now I will start to show you how to doff it. First, I'm going to start with removing my gloves in a way that I am not touching any of the outside material on the gloves and disposing of that accordingly. Next, I'm going to proceed with hand hygiene. And like before, you do this until it's completely dry. My next step is removing my gown, and like my gloves, I want to do this in a way that I do not touch the outside affected area. By grabbing the top, I'm going to flip the gown inside out and dispose of that as well. My next step is hand hygiene. Now that my hands are dry, I'm going to proceed with removing my goggles and disposing of them, and also disposing of my mask. My last and final step of doffing is hand hygiene again. You want to do this until it's completely dry. If there is any soiling on your hands, then you will proceed with washing with soap and water. And that is the last and final step of my donning and doffing lab for Nursing Foundations. Thank you so much.